Subscribe to my channel for latest videos. Polymyositis (PM). Polymyositis is a type of muscle disease called an idiopathic inflammatory myopathy (IIM). It inflames your muscles and their related tissues, like the blood vessels that supply them. It can cause muscle weakness and pain, often on both sides of your body. This type of myositis mainly affects the skeletal muscles and causes progressive muscle weakness over time. It typically involves the muscles in the hips, thighs, shoulders, and neck. Disease condition. Polymyositis causes muscle weakness on both sides of the body. Having polymyositis makes it hard to climb steps, get up from a seated position, reach overhead, and lift. It can affect anyone of any age, but is more common in adults ages 31 to 60 years of age. Risk factors for polymyositis include autoimmune conditions like lupus, rheumatoid arthritis, scleroderma, Sjogren's syndrome, viral infections like HIV and AIDS, breathing difficulties, lung diseases. Symptoms may include inflammation and weakness in skeletal muscles, weakness in the proximal muscles, those closest to the chest and abdomen, arthritis, including mild joint or muscle tenderness, shortness of breath, problems with swallowing and speaking, heart arrhythmias, improper heart rhythm, fatigue. Dermatomyositis (DM). Dermatomyositis is also an idiopathic inflammatory myopathy (IIM), but has additional symptoms that affect the skin. This type of myositis is also associated with other autoimmune disorders. Children and adults can have this condition. Disease condition. This type of myositis affects both the skin and muscles. Dermatomyositis (DM) is easier to diagnose than other types of myositis. It is distinguishable because of the purple-red, patchy-like rashes it causes. These rashes appear on the eyelids, face, chest, neck, and back. Symptoms found on the skin include small, tender bumps on the knuckles, swollen rash that is blue-purple in color, skin redness that may turn scaly, cracked skin around the fingers. These symptoms can be triggered by the sun and can be itchy. Chest and the front of your shoulders, also known as AV sign rash. Neck and the back of your shoulders, a shawl sign rash. Other symptoms may include calcium deposits under your skin, ragged cuticles and prominent blood vessels on your fingernail folds. For more about myositis and types, visit playlist or links in description.